University of Vermont recently announced a groundbreaking new vaccine for dengue, a highly contagious disease that's found in warm climates like Brazil and India, and in the U.S., in states like Florida and Texas. The disease impacts about 100 million people per year and can cause intense symptoms like fever, nausea, and bleeding. Our Yamuna Turco spoke with researchers at UVM. She joins us live in the newsroom now. Yamuna, what does this vaccine mean for people who might visit high-risk places?
Well, Lauren, like you said, dengue is very contagious. And for people who live or go on vacation to places like Florida, the new vaccine and antiviral medication can help prevent you from catching the disease.
One of the most important things when we think about disease is really prevention.
The University of Vermont, along with Johns Hopkins and the NIH, have announced a newly approved vaccine to prevent dengue, a disease that impacts more than 100 million people globally per year.
Here at the University of Vermont, I've been working on this for about 16 years, and our colleagues at the National Institutes of Health and also Johns Hopkins have even been working on it for longer than that.
Dengue, like malaria, is mainly spread by mosquitoes and can cause fever, bleeding, or even death. The disease mainly is found in warm areas like Brazil, Kenya, or Florida, and the vaccine will greatly reduce the risk of infection in those areas.
The first use of it will be in Brazil, and there's enormous dengue outbreaks in Brazil, so it's a really fantastic place, and we're glad they have it to be used.
The vaccine isn't the only new defense against dengue. UVM and Johns Hopkins have also developed a new antiviral medication, which researchers say can help greatly reduce the number of people that are exposed while traveling.
And the idea of this antiviral is that you would take it as what we call prophylaxis. So you would take the medication knowing you were traveling, you might be at risk of getting dengue in lots of parts of the world. So you take the medication, you start it before you go, and you take it while you're there.
Researchers say much of their work, especially when it comes to testing, relies on volunteers. And they say the development of the vaccine and antiviral would not have been possible without their help.
We use volunteers from the Burlington community to help us with this work, and so we would have never been able to get this far along if it really hadn't been for the generosity of the volunteers.
And Brazil has already licensed the vaccine and will include it in their national immunization program. Researchers say they expect other countries will add it to their programs in the coming months or years. In the newsroom, Yamuna Turco, NBC 5 News.